I'm joined by Ameera Shah, Managing Director of Metropolis Healthcare, at the conference in which they've announced their initial public offer. Thank you so much, Ameera, for speaking to Bloomberg Quint. So let's start off by understanding what led you to tap the primary markets just before election.
I don't think we timed it in some perfect way. I think we just started working on our launch, and the markets in February were not looking so conducive. Fortunately, March has looked a little bit better, so we thought there's a window, so let's go for it.
You talked about the 3 growth levers during your presentation in which you plan to grow the company. If you could elaborate a bit more on that.
Sure. I think the main growth levers for us is one is geographical expansion and really going closer to the patient. Today, large market is unorganized in our industry, and most people are using the unorganized sector, the small labs on the street, for getting their tests done. This obviously is a huge opportunity because we are seeing the consumer of India changing and wanting to go to a place which is more hygienic, more safe, better quality infrastructure, getting better features and better quality. So from that perspective, if we are able to create our infrastructure closer to the patient, then patient doesn't have to choose between quality and convenience, but we are able to get quality, convenience and great experience with us. So we think that's going to be one of the big levers of the company in terms of the retail strategy of the organization. We are very strong in 5 or 6 markets in India where we are leaders from a brand perspective. But these are markets which are not at all fully penetrated. These are actually markets that we feel that we have a huge opportunity to grow. So we are continuing to expand our market network expansion there, which will take us closer to the patient and therefore increase our market share. So that's definitely one. The second strategy lever is another geographical expansion, but that's on the B2B side, where we have about 9,000 touch points, which means hospitals and labs which are sending us samples on a daily basis, where we are picking up samples for specialized tests. We do about 4,000 varieties of tests, while even the top hospital will do 400 or 500 varieties. So there are a whole range of tests which hospitals don't have the capability to do, which they outsource to us. This specialized test is actually what makes us, our expertise, our quality, our credibility very, very high, and why we are called as a pathology specialist in the industry. So continuing to expand the number of touch points, pickup points, where we are picking up samples from hospitals and labs will be a second part of the strategy. The third part of the strategy is really a product mix and a product portfolio, where today patients are coming in, let's say, for lower value tests with education of the doctor and the patient, where the patient requires a more effective diagnosis and requires a better technology to be used to give them a better quality of testing. Patients actually move up the value chain, and therefore the test mix changes. And that's the third lever of the organization in terms of the growth of the business. Traditionally we have also been good at doing acquisitions, and that will continue to be the fourth lever.
So considering you've talked about expansion and acquisition both as part of your growth levers, help us understand, you've recognized 8 seed cities and there are 5 focus cities that you look to focus on. What would be some of the strategies, whether it be inorganic growth that you'd be eyeing in the focus cities, and especially for the seed cities when you talk about coming closer to the patient? How do you really plan to do that?
See, I think we are present in 173 cities across the country. When we say we will focus and we will spend more of our time and attention on the focus and the seeding cities, it's only a matter of allocation of our time and our money and our bandwidth, right? So we will focus on these 13. In the focus cities, we want to go deeper, which means we want to expand the number of centers in that market that we are already leaders, but we want to double the networks there. In seeding cities, we need to continue to build breadth, because in these markets we have traditionally not had much presence. So we want to build breadth in these markets. So we will definitely, that's going to be our mainstay as far as our thing and our growth. The acquisition piece, we've done about 20 to 25 acquisitions in the last 18 years. So every year we have done 1 or 2 acquisitions. We are considered to be great partners to pathology laboratories. And we see a lot of pathology laboratories coming to us saying that, look, please partner with us and take us under your umbrella, because they enjoy working with us and they also get commercially rewarded for it. So I think that will again continue to be a key strategy for strategic entry into new markets for us.
So with the seeding cities and also for the newer markets, you look to expand through acquiring more of pathology labs as entry points and then building on that. Would that be the model?
No, in these 13 cities, we already have labs. So we don't need to acquire labs to grow in these 13 cities. In these 13 cities, we will grow organically. It is new markets outside these 13 cities that probably we will do acquisition.
And which would be some of the new markets that you'd be looking to cover apart from the seed and the focus cities?
So like I mentioned, we are present in 173. It's about cities. It's about which cities we want to increase our presence in. So, I mean, there are many markets in where today we feel we don't have a significant presence, which are opportunities. You know, Andhra Pradesh, Telangana is not a big area for us of presence. So that could be definitely something that we look at from an acquisition standpoint. It could be North India, even parts of East India, markets like Punjab. We are seeing a great pickup for Metropolis business. We would be happy to look at some acquisitions in these markets. So, I mean, we're open to all across the country. There's no specific market, but they're always as strategic entry points.
Most of your business comes from third-party partners. So, although you do have 256 patient service centers that are owned by you, so would it continue to be a third-party focused business, or would you look to reorient to more owned patient service centers as you move along?
Actually, most of our revenue comes through owned patient centers. While the majority of the network is third party, that network is very young. It's only in the last 2 years. So actually, if you see, we have expanded from some 300 odd centers to where we are today, which is a 400% growth that we've expanded with in terms of network expansion. But the revenues are still predominantly coming from the original centers which we own. This is going to be the big opportunity for the company going forward, because this new network that we've built is still not at peak or at maturity. So they will continue to give us great revenues as we move into the future. And the idea is not to stop at the network it is today, but to actually double it.
So would it be more owned versus third party?
In terms of the expansion of network, it will be mostly third party.
We also spoke about the pricing pressures in the market of pathology, especially with the increasing competition and similar models that are also there in the market, be it ThyroCare that also follows a hub and spoke model. So tell us more about this. Tell us more on how you see the pricing sustaining in the future, and how do you look to stand out from your peers in the market?
See, if you actually see the market, there are two listed companies in the diagnostic services space. One is Dr. Lal's and one is ThyroCare. I think our model is much more similar to Dr. Lal's, probably not similar to ThyroCare. So the peer set is a little bit different. If you actually look at, and the reason for that is because we operate mostly in the illness space. We take care of patients when they're really unwell or a little bit unwell, and they go to a doctor and they need to get testing done. From what I understand, ThyroCare is more in the wellness space, so therefore we don't actually land up competing much at all. As far as price competition and price we actually don't see that too much, because you have to understand, when a patient or somebody in your family is not well and requires the right diagnosis to get the right treatment, they are not going and shopping around looking for who gives the cheapest test. They are shopping around to say who gives me the correct report, because I need to treat my mother or my father. So actually the price competition is, and people come to pathology labs once or twice a year and the average spend is 500-600 rupees. So it's not something which is either bankrupting them, it's not even a frequent spend. So actually price is not something which is bankrupting people because of diagnostics. Usually you see people spend a lot of money when they're hospitalized, not because of diagnostics. So actually price is not a huge concern for patients even.
You've also tied up with some of the government insurance schemes. One of them is CGHS, and help us understand what the model or the partnership pattern there is. And would you also look to partner with the government on Ayushman Bharat for that matter?
See, CGHS is basically central government health scheme where the government pays for people who are employed by the government for their healthcare, and they basically partner with companies like ours and few others where they offer our services to their employees at a discount. So whenever the government employees need pathology test, we are on the panel as well, and they can walk into our centers and avail the discount. As far as excuse me. As far as what you mentioned about Ayushman Bharat is actually today only relevant for hospitals. It's not relevant for diagnostics. So while I'm very happy as a citizen of India that we are extending the health net for more people who are not well off, It's not applicable to diagnostics.
Let's talk more about the business. You said that you have a lot of room in terms of expanding, also in terms of spending more on the business. So, what is the capex that you've budgeted for the next fiscal, and how much room then is left for making acquisitions?
See, last year, for example, we had a free cash of almost about 115 crores, of which capex really every year is only between 10 to 20 crores maintenance capex. It's not a significant amount of capex. So therefore, we have a good amount of cash for acquisitions, which is how we've been growing, doing not only organic growth but inorganic growth as well out of internal accruals. So I'm not expecting a big capex cycle in the next few years.